Please follow the signs for new arrivals.
Hi, my name is ARBL Murray for World Radio Paris, New Arrivals, our tips and tricks for those of you who have just made it to France. Today we're talking about what to do if you get sick or have an urgent need for medical care. If you aren't in the system, meaning registered for French insurance or Social Security, access to care, although available, can be tricky and daunting to navigate at first. So straight off the bat, there are some very important helpline phone numbers in France that you should know. First of all, the ambulance, or as they say in French, SAMU, S-A-M-U. That would be 1515. The police, 1717. The French fire brigade, or pompiers. That would be 1818. They're who you call if you have a gas leak or there's some urgent life-threatening condition in a public space. There's also a general pan-European emergency number 112, and the operators speak English. So what do you do if you get sick, but not so sick that you necessarily need an ambulance right away? Your first stop is probably going to be the pharmacy. Unlike other places, pharmacists in France are well-versed in treating non-lethal conditions. They have at least 6 years of higher education and can even advise on medications both over-the-counter and prescribed. Cuts, bruises, surface-level infections, they give COVID tests, they can help treat allergies, even extreme ones. They can give advice on viral infections, pediatric care, sprains, and first aid. The second thing, if something is not super urgent, you can do is register on a website called DOCTOLIB. That would be DOCTOLIB.fr. Once you register there, you can kind of sort through a bunch of different doctors in your area and pick and choose. They will even list what languages they speak. However, a word of warning I will say is that often I have selected an English-speaking doctor, and some of them speak little to no English. It's just something you have to navigate in the French medical system. Doctolib is a great resource. It will show which doctors have availability, who's taking on new patients. In France, it's also important to note that a lot of your blood tests and things like ultrasounds or MRIs don't happen in one place. The doctor will give you a prescription for blood tests, and then you will take that prescription to a lab, of which there are many in the major cities, and that's where you get your blood tests. So you are running around a bit, and you're expected to keep track of all of your own medical records. They're not all going to be housed with your general practitioner. I remember it was kind of a shock when I had my son here, and basically you have a little booklet for your child where you're expected to make sure no matter what doctor you go to, what vaccine you get, you make sure that that record is in that little book, and that's your kid's, Bible for their medical history. So the last thing I'm going to talk about is something that I kind of got into the history of a bit. It's called SOS Médecins, and this is a service where it's 24 hours a day, 7 days a week, and if you call them, doctors will come to your house and treat you. At times, often can't make it to a hospital, or you don't want to go because it's not quite as urgent. These doctors will also be able to advise on telehealth visits. Like I said, the history of SOS medicine is very interesting. In the summer of 1966, 4 years before France would get emergency services like ambulances and the SAMU, the founder, Marcel Lascar, who was a general practitioner, had a patient who had a heart attack and died simply because it was a Sunday and there weren't any doctors available. He found it interesting that he was able to get a plumber on a Sunday, but not a doctor. So he started SOS Medicine. He would often say the phrase, "We look after water pipes better than we look after the piping of people." Marcel even asked a plumbing service, whose name was SOS Plombières, if he could make a medical version and use the name. The service was immediately successful, and the press picked up on it as well. Everybody loved the idea. Now, SOS Medicine is in at least every major city in France and many smaller regional areas. Unfortunately, as of 2021, SOS Medicine has pulled out of a lot of regions in France that are designated to be medical deserts, struggling with healthcare in general. But that's a story for another time. Thank you for joining us. I hope this was helpful.